Joining me now, emergency medicine physician at Texas Medical Center, Dr. Hilary Fairbrother. She's also associate professor and vice chair of education at the McGovern Medical School at the University of Texas Health Center at Houston. Dr. Fairbrother, I spent a lot of time in Houston, and while it's known for oil and other things in Texas, it is known as a remarkable center of health care. You have some of the finest hospitals in the country in Houston, and you have the same information everybody else had about coronavirus. How did it go so wrong in Texas?
Well, thank you for those kind words. We're very proud of our hospitals and very proud of our medical center. It's the largest in the world. How did we go so wrong in Texas? That is the million-dollar question. Everyone has their most current theory. Texas never got the number of cases that we were supposed to get. We never got the spike that we were reported to be looking for. And then starting May 1st, we started reopening and our government started reopening. And it wasn't that surprising because we didn't have the number of cases that we were supposed to get. We did phased reopening like recommended, but we didn't have a decline in cases. And we knew in the background that coronavirus was looming. It was there. It had never left our community. It just had never affected as many people or put a strain on our healthcare resources as we had seen in other areas, particularly New York City. And then what happened, I believe, and I think most people agree, is as there was more and more phased reopening, particularly with more and more events that got people together, our amount of mask wearing and social distancing through our reopening was really not what you would want in order to prevent disease spread. So combined with reopening, combining people being back together again, plus not wearing a mask and not social distancing meant for uncontrolled disease spread. And now we've got 2 weeks of escalating cases, 2 weeks of escalating hospitalizations. We are at capacity with ICU beds, and we are where we are now.
You are where we were many months ago or many weeks ago in New York. The Surgeon General has just put out 6 tweets about the importance of mask wearing, and I would suggest people read them. But Dr. Fairbrother, part of the problem here, writ large, never mind coronavirus, part of the problem writ large is the politicization of science. America, Houston, New York, we have some of the best epidemiologists, infectious disease specialists, academics, doctors, emergency room doctors like you in the world, and they did provide us with evidence. We on MSNBC have been having this conversation since January. We know what we can do to prevent the spread of this disease, but we have politicized science, and we have now politicized public health.
I agree with you. I think that the politicization of science is one of the reasons that we are feeling coronavirus far more deeply than other countries that we might look a lot like, whether that's in Western Europe or around the world. And it makes me sad. It pains me. I understand why people are confused. If they go online,
Sure.
If they listen to different news sources, I get why they're confused because there is such an incredible amount of mixed messaging. But I like to say, listen, if you have a question about your health, if you have a question about science, ask your doctor, ask a scientist. Stop going to a politician for news about science. And I think that would be a lot less confusing for people because I know the scientists in the country, I feel their frustration as there has been a pretty consistent message through physicians and scientists about how to social distance, how to wear a mask, how to keep each other and our communities safe, how to keep our communities that have reopened safe. And it's not always on Twitter by somebody who doesn't have any healthcare background. Like we have to get information from sources and from our scientists. And I feel for people that they are confused, but we have people out there that are delivering a consistent message. And I ask you, please, if you have a question about coronavirus, ask your doctor.
So let's leave everybody with these words. We beg you, please stay at home. Please socially distance. Please wash your hands. And when you absolutely have to go out, please wear masks. This helps everyone, and this helps including people like myself who have to go to work so that we can take care of everyone who gets sick in the city of Houston. Those are your words. Dr. Hilary Fairbrother, thank you for joining me, Associate Professor of Emergency Medicine at the McGovern Medical School at the University of Texas Health Center in Houston.
Hey there, I'm Chris Hayes from MSNBC. Thanks for watching MSNBC on YouTube. If you want to keep up to date with the videos we're putting out, you can click subscribe just below me or click over on this list to see lots of other great videos.